welcome back. So, in terms of issues pertaining to medical supplies, I know in news abound in terms of condoms and what happened to them, and many other issues pertaining to quality drugs. Today, we remove the dots and cross the T's in terms of finding exactly how the system works. The Kenya Medical Supplies Agency has been in people's minds in terms of how does it work, and sometimes to an extent being confused in terms of how it works. Is it parallel to the Ministry of Health? Is it still part of the Ministry of Medical Services, or how does it work? To tell us more about this and to be able to engage you and I in terms of this discussion, we are joined by the Chief Executive Officer for KEMSA, Dr. John Munyo. It's good to have you.
It's a pleasure, Jimmy.
Before this, let's talk about Dr. John Munyo. What were you doing before Chief Executive Officer for KEMSA?
I have been with the Kenya Medical Supplies Agency for now roughly 4 years.
Right.
Before then, I worked with a multinational pharmaceutical firm for about 17 years.
Wow.
In various capacities, mainly in commercial management, in marketing. Worked mainly in Kenya, but also a lot of interaction with other international markets, France, right. South Africa, Germany, and finally settled here in Kenya. And I decided when I got the opportunity from the Kenya Medical Supplies Agency to try see how it is from the other side, and I decided to take that risk, and I switched over from the private sector to the public sector.
No regrets?
I have no regrets. A lot of challenges.
I can imagine.
New things I learned.
In fact, let's talk about those challenges and new things that you found. What did you find when you walked into KEMSA?
One of the things that I really learned is the different environment. The different in culture. There was a lot of cultural realignment that I had to do. The environment was very different. Things that you can do in a day or two, you may have to do them in 2 weeks, in 2 months.
Wow.
Bureaucracy,
yes, of course.
issue of government bureaucracy. But all in all, administration is administration, management is management,
That is true.
and the principles are the same.
That's
so we have been able to cope, and I really enjoy it. It's very challenging, and it's really stimulates one to grow in terms of administration and management.
Absolutely.
Yeah.
You know, I will be very honest with you. I was very surprised when I was just going through stuff that you have done as KEMSA compared to 2003 and thereafter, basically what used to happen. And you're right in terms of the confusion that people have in terms of KEMSA. Talk about what you've done so far, what you found in terms of operational activities, and the challenges that were there, and what you have done to circumvent those challenges.
The main challenges that we had in the Kenya Medical Supplies Agency is mainly on the supply chain. The supply chain is that process of acquiring the medical supplies, to warehousing them, to delivering them where they are wanted, and making sure they are used in the right way. And most of the challenges were around this area, because first and foremost, the infrastructure for warehousing the medicines was in very bad shape. The distribution system wasn't that effective to be able to reach the end user, the facilities, the patient, who eventually depends on that paracetamol, that Panadol at the end of the day.
Yes.
And then we had a lot of structure and system issues. A lot of issues and medicines not getting to where they're intended, some of them getting lost in the way, some of them getting pilfered out of the facilities. A lot of challenges. We didn't have systems in terms of the systems were very manual. And therefore, when you have a lot of paperwork, the speed, the efficiency, transparency, and accountability were issues. So that was one of the challenges. We did not have a lot of, we had a very bulky commodities. We did not have enough material handling equipment, the machines, and the small machines that you need to lift these to load on the truck. We didn't have enough of these. And more importantly, even the legal framework that under which KEMSA is constituted was rather weak, and it is still a challenge, and it gave room to a lot of other interested stakeholders and people within the diaspora to interfere and affect the smooth operations and service delivery of the organization.
Absolutely.
That was the situation, and therefore, because of those challenges, service delivery was very poor.
Slow, yes.
The medicines were not reaching the intended beneficiaries in the right quantities at the right time. The procurement of the medicines was not taking place timely in the right quantities, and therefore there were a lot of cries, hue and cries from the intended beneficiaries, the patients in the public health facilities, And therefore there was need to look into a totally different way of doing business. And it is at this point that the Ministry of Health then and the other stakeholders within the health sector came together and sat and looked into better ways of coming up with an independent entity that would be specialized, would have skills and experience in terms of medical logistics to address all those challenges,
Right.
and ensure that this very special commodity we call the dawa, the medicine, is delivered to that mwananchi who needs it efficiently, professionally, and in a way that that it gets where it's needed at the right time. Because for medicines, if it doesn't get to the intended user, if it's to Jimmy, if you need that painkiller and you don't get it in time, then you lose the benefit of it.
Absolutely. Just a question here from Raymond Cheroyot, and he says, as a way of streamlining operations and controls, have you managed to source a stable financial and procurement management software? That's what you're talking about now. Perhaps expounding a bit more in terms of the software that you're using now. Is it in place? Is it working?
Yes, I would want to respond to the viewer and say that as we sit here now, we have implemented state-of-the-art software, an enterprise resource planning system. It went live in July last year. And this enterprise resource planning system has automated every business process in the organization.
Well done.
So we
Well
have
done.
automated the entire medical logistics chain, from procurement all the way to warehousing to distribution. And therefore, in terms of procurement, we have the transparency, the accountability, and everything is transparent. In terms of the warehousing, the efficiency, now we have attained the efficiency. We are paperless. We are able to turn around, the order turnaround time, the time it takes from when the hospital gives us the order to the time we take it to the facility. It takes much less time. And even in terms of the distribution, we are able to track the transporters who are delivering the medicines to where they are needed. We are able to track them from KEMSA until they get to the locality, to whatever destination they're intended to. This happens because we have this enterprise resource planning system. It is still undergoing implementation because we are currently rolling it out to our regional warehouses. We have 8 regional warehouses in each and every province. Of course, I'm counting Nairobi as well.
Yes, absolutely.
And when it is finally, it is a 5-year project. When this project is finally completed, we expect that not only are we automated within the Kenya Medical Supplies Agency, but all the public health facilities will be hooked, will be connected to that system. And therefore, we'll be talking electronically. They do not need to send papers. They don't need to send faxes. All they need is to log into the system, check how much dawas we have, when their medicines were dispatched, what is there, what is not there. And if they need to place orders, they will just go to the system and place their orders electronically. And therefore, we will bring efficiency. But for this to happen, Jimmy, it will require also that the facilities themselves are also ICT compliant. They need to invest in the necessary software. Our software is in place, it's working. We have already completed the first phase. Now we're in the second phase where we are rolling it out to the regional warehouses. And in the third phase, we will now be asking the facilities. Right now we have about 4,500 facilities. And the system we have is capable of connecting up to 8,000 facilities.
And you're saying this is what will take, what, another 5 years?
The entire project life. And when I say about 5 years, it's up to the time we expect the facilities to be connected. But as we talk, centrally from the Kenya Medical Supplies Agency is up and running 100%.
I see what you mean.
Yes.
In terms of connection or that communication between KEMSA and the medical institutions, and we see now a lot of health centers are being built by CDF funds. Do you as KEMSA have a role to play in terms of an audit system? I mean, do they fall under your gambit and you're able to access them in terms of supplies, so to speak, or how does that work? Do you work closely with CDF? Do you verify that the health centers that you're being asked to supply drugs to actually exist? How do you monitor that?
Yes, currently, as I said, we have more than 4,000, 5,000 facilities. And as we sit here, we are supplying 1,000 CDF facilities. We are not supplying all the constituency development funded facilities, health facilities at the moment because of funding constraints. And yes, we interact with each one of the facilities that do exist in this country. We are organized in such a way that in every region of this country, we have a customer service team based in each of the provinces. There is a regional manager, and there is a field staff who go around and interact with the health managers on the ground. They check if they have any issues, if they have received their supplies, if they have any issues that they would like to be sorted out. And we visit them we have a routine visit schedule based on the regions. And therefore we have different teams. So we have 8 different teams, just like we have 8 different regions. And also in terms of interacting with them, we have regular forums with these facilities. Like, as I sit here, I've just come from Nakuru. Right now, the board of directors are going around. Last week, but one, we were in North Rift, Western, and Nyanza. This current week, we were in South Rift. Today, as we sit here, they're in Central. Tomorrow, they'll be in Eastern. And the week after will be Northeastern. And the week after then will be in Coast. So these are interactions forums where we randomly sample facilities, interact with the facilities, so that we get to know which facilities are in what state and what challenges they have, and how best can we improve service delivery to those facilities. So yes, we interact with them, but from the aspect that you said, we discussed earlier about being connected electronically, of course, that we still have some way to go.
Absolutely.
But we have constant communication, because they place orders to us, and we give them a feedback, and we deliver their orders to their doorstep for all the 400